And if you can just go ahead and breathe in and hold your breath. And again. No carotid bruits noted on auscultation. I'm going to go ahead and feel for your carotid pulse. The carotid pulse is bilaterally equal in pulse, amplitude, and rhythm at a 3+. The trachea is straight and midline. Spaces are equal on both sides, no nodules, enlargements, or tenderness noted. And then next I'm going to check your lymph nodes. And this will be your preauricular and your postauricular, your occipital, and your tonsillar, and your submandibular, and your submental, and your posterior clavicle chain, cervical chain, and your deep cervical chain, and your superficial cervical chain, and your supraclavicular chain. So all lymph nodes are palpable and non-tender to the touch. So next I'm going to go ahead and cover you up like that so I can look at your legs. So both legs and feet are bilaterally symmetric in both size and shape. The skin is evenly pigmented. Temperature is warm and even, dry to the touch. Her skin is intact. There's no edema, lesions, bruising, or swelling noted. Hair is evenly distributed. The toes and feet are equally warm bilaterally, and the legs. The patient's nails are clean and smooth, no cyanosis noted, and capillary refill is brisk and is less than 2 seconds. So what I need you to do is go ahead and flex your foot flexion and push down, extension, and then if you can just move your leg like that. Okay, so abduction, and then against me. Okay, adduction, and then again abduction, and then back in, adduction. So the patient is able to move through all full range motion without discomfort or noticeable limitations. Patient is able to perform range of motions against resistance of the legs and feet without any notable tenderness. Muscle strength is equal bilaterally. Next I'm going to check her popliteal pulses. Okay. And her dorsalis pedis pulses. And her posterior tibialis posterior tibial pulses. And her popliteal dorsalis pedis and posterior tibial pulses are 2+ and are equal bilaterally. And the femoral pulse can be found right here in the crease of the groin area. Next I'm going to check your reflexes. I just need you to relax. Your popliteal reflexes. Okay. And then your Achilles reflexes. So patellar and Achilles reflexes are elicited at a 2+ normal. So I would have you turn around. The thorax is symmetrical bilaterally. The skin is warm and dry, evenly pigmented, no observable edema, lumps, or lesions. The scapula is symmetric and non-protruding. Shoulders and scapula are at equal horizontal positions. Her spinous process appears straight and thorax appears symmetric. No lumps, no lesions, no tenderness upon palpation. Her respiratory pattern is regular, even, unlabored, and symmetrical. Her effort appears to be non-labored with no obvious retractions or use of any accessory muscles. No, so I'm going to have at the T9, T10, I'm going to squeeze together. Breathe in, breathe out. So chest expansion is symmetric. And I'm going to listen to her posterior lung fields. Breathe in, breathe out, or breathe in, breathe in, breathe in, breathe in, breathe in, breathe in, breathe in. So bronchiovascular breath sounds were heard. There's no obvious wheezes, bronchi, crackles, rubs, stridor, heard bilaterally. The thorax is symmetrically bilaterally warm, dry, even, pigmented, no observable edema, lumps, and or lesions. So for her anterior chest, the front, the respiratory pattern is regular, relaxed, effortless, quiet, and symmetrical. Her effort appears to be non-labored with no obvious retractions or use of the accessory muscles. There's no lifts or heaves noted. There's no thrills. No thrills noted. And no pulsation of the PMI at the fifth intercostal space is palpable. Listen to the front. Breathe in. Breathe out. Breathe in. 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 So breath sounds are symmetrical with no obvious signs of wheezes, bronchi, crackles, rubs, stridor, bilaterally. So next I'm going to have her lay on her left side. And I'm going to listen for her PMI. So aortic, pulmonic, Erb's point, tricuspid, mitral, the apical pulse. So apical pulse has a regular rate and rhythm with no obvious murmurs, gallops, or rubs. S1 was louder in the apex, and S2 was louder in the aorta. I'm going to go ahead and have you lie down for me. And I just need you to look to your left. While I do that, get my pen light. So jugular pulsation is visible in the supine position. Next, I'm going to raise the bed to a 45-degree angle and have her again look to the left. Jugular pulsation is still visible at the 45-degree angle. And then I'm going to go ahead and raise the bed again to 60 degrees. So there's no visible pulsation at 60 degrees. And then if you can just go ahead, and sit up for me for a minute. And then look at the side. And then there's no jugular pulsation present at 90 degrees. All right. You feeling okay? Okay. So for her, I'm going to have to lift this up. I'll cover your legs. So the skin is uniform in color and pigmentation. There's no scars present. There's no striae, no rashes or lesions. Her umbilicus is midline. It's inverted with no signs of inflammation, discoloration, or drainage. It's warm and dry to the touch. The abdomen is flat and equal bilaterally. So now I'm going to listen to the 4 quadrants. Right upper quadrant. Left upper quadrant. left lower quadrant, right lower quadrant. So normal active bowel sounds are present in all four quadrants. There were no bruits, venous hums, or friction noted. And in the upper right quadrant, there were some hyperactive gurgles noted. And then I'm just going to palpate your abdomen in the same quadrants. So, right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. So there's no tenderness upon palpation. The abdomen appears relaxed with smooth and consistent tension, and there was no muscle guarding noted.